Well, from the pinnacle of musical Welsh civilization to something rather darker, we are going to talk about violence, and we're going to talk about violence prevention, and particularly an innovation in violence prevention which has been developed here in Cardiff in the university, which has been adopted by the coalition government in Whitehall and by the World Health Organization. So it's something of a Wales export. It's my great pleasure to talk about now. There we are, that's me. I'm in my work as a surgeon. I see people who've been injured in violence, and it's very distressing. Here's a young man, 17, hit with a Stanley knife, and he's scarred for life. It is not fatal, but it's got huge social consequences and psychological consequences for him, which are quite obvious. And he's a young man, so he's got to live with this for maybe 60, 70 years. It's really tragic. So what can we do to prevent it? That's the question. Now, it happens that globally, violence is a very important cause of death for young people. So you can see from this is World Health Organization information, that violence, that's excluding self-inflicted wounds, excluding wounds caused in wars, that violence is the 5th most common cause of death for those aged 16 to 29, and almost as frequent cause of death for those aged 30 to 44. So it's really a huge problem for young adults. Now this is a picture of hell let loose, isn't it? This is Peter Howson from the Glasgow Art School. This is the kind of thing that we all know about that happens in our city centres on the weekend, on a Friday and a Saturday night. It's unrestrained inebriation with broken bottles. I see the imprints of those trainers on the faces of my own patients rather too often. So it's a loss of control, and it's this kind of situation we want to try and intervene in to prevent these awful injuries. Now, what started, I'm going to really tell you a story about this violence prevention enterprise. And what started it all off was some research of ours which found that an awful lot of violence which puts people in hospital is not known about by the police for various reasons. So in this particular study, only about a quarter of victims put in hospital were recorded by the police. And we found also that violence recording by the police varies by age and location and gender of the victim. So a young man injured in a nightclub and winds up in hospital is very unlikely to be reported to the police for various reasons. But an older woman who's injured on the street, that's very likely to be known about by the police. And this finding is confirmed by national surveys like the British Crime Survey. Now, this is an international problem, it turns out. There's been similar studies matching up police and casualty data, mainly in Scandinavia to start with. And this is an example from Denmark. And the casualty doctors there found exactly the same thing. Look at the number in the middle there. Only 23% of victims were known about by both the police and the local A&E department. So from this, the conclusion, the implication came to us that there's the potential for using information collected in casualty about which pub it was, which nightclub it was, which street it was, which park it was, which school it was, to use that information as a new source of intelligence to tackle violence in our communities. So what do? We thought about this new source of intelligence, if you like, putting it in the police language, new source of information about violence, in two ways. Thought about it, well, we thought we can measure violence pretty accurately across the country by using this information, but most importantly, and look at the bottom there, we can use it potentially for local prevention, for actually stopping the violence happening in the first place through good policing and other methods. So what do? Back in 1996, we put together around the table, group of people from the agencies involved, so that the police, South Wales Police there, Cardiff County Council, the university in there centrally, because it was a new idea, so we wanted to evaluate it very carefully. Health, that's the old BroTAF Health Authority, and victim support, which is the third sector organisation involved with supporting victims. And this became the statutory approach actually, in the Crime and Disorder Act 1998, first flagship bit of crime legislation in the early years of the Labour government. And so now every square centimetre of the UK is covered by one of these partnerships, which is rather thrilling. Now, put some flesh on the bone. So this is when Jack Straw came to see us. He was the Home Secretary at the time. So left to right, South Wales Police, Chair of the Licensing Magistrates, my casualty consultant colleague, a local government official, the Home Secretary, a rather younger looking me, isn't it? The Chair of Cardiff Victim Support, and Alan Michael, who's actually the MP for Cardiff South and Penarth, in whose constituency we're now sitting. Who actually took this bill when he was police minister through the House of Commons. And so this is an important test bed, if you like, for engaging with local politicians, ministers of the day, to try to get our research implemented out there in our country. So what do? We use this information from casualty to target violence hotspots, to identify them in the first place. Which pub was what nightclub, which street location, Wood Street out opposite the post office. And these are all hotspots that the police didn't know about from their own intelligence. Also very relevant to alcohol licensing, of course. Introduce information from A&E, from casualty, into licensing hearings, and you've got a completely different lot of information in which to manage bars and nightclubs and pubs, etc., around the city. Making weapons less harmful. I'll come on to an example of that in a minute, to do with glasses and making them less harmful. Pedestrianisation of entertainment streets. So St Mary Street here was pedestrianised to give people more room to move about, because if there's one thing we know about violence is that it tends to kick off spontaneously, so after people bump into each other. So give people, especially intoxicated people, a bit more room, a lot more room, they don't bump into each other, and there's less violence. And then identifying and helping people injured in domestic violence. So many victims of domestic violence come to A&E, come to casualty, and so the system of this data collection helps us to identify them and help them through the support process to make sure they are kept safe. What did the results look like? Well, this is a graph. There's one or two graphs for you to have a look at here. So we introduced this information sharing enterprise about here. So it's fairly steady state along here. There's a France-Wales rugby game about here. I don't think that was terribly important, actually. A bit of a coincidence, perhaps. But then when we started to feed this information in from casualty, we started to see violence fall. And it fell by about 40%. It's large numbers prevented, which seemed very surprising for us. This is men and this is women, so also an effect for preventing women from being injured in violence too, and coming to casualty. And at the same time, we began to see Cardiff move to the top of its, or the bottom of its violence league table. So this is the place to be. This is Cardiff, 2007, other cities, Leeds, Northampton, Lincoln, Plymouth, Leicester, Coventry, Birmingham, Derby, etc., and Cardiff became the safest city in its family of cities designated by the Home Office in around 2007. So despite what you might read in the newspapers, you are living and now sitting in a very comparatively safe city where you're much more unlikely to get injured than in many other cities now. Now, this is the most scientific I get. And so this is before we started sharing the information. So Cardiff are the blue dots, other cities are the red dots, marching along together. They changed the system of crime recording, so that's why everything increased. But as soon as we instituted this information sharing and use, violence in Cardiff started to go down, and in the other cities it went up. And then we got sustainable difference, clear water between the two, at the end there. So that's evidence of that 7-year experiment, and so that's evidence of sustainable increased safety. And this had a real impact on the local health service and the local policing. So hospital admissions for violence went down in Cardiff and it went up in the other cities. That's about 500 fewer hospital admissions in a year. You know, that's a lot of work for me, avoided. You'd have to probably employ 4 people like me for a whole year to treat that many. And woundings recorded by the police, they went up actually overall in both Cardiff and the other cities, but they went up double the amount in the other cities than they went up in Cardiff. So also that was good news. And I should say this person, Curtis Florence, works in the Centers for Disease Control in Atlanta in the United States and did these calculations for us completely independently. So on we go, and it's very cost beneficial. So the cost of collecting this information, sharing and using it, about £5,000 a year, but the benefits are around almost £1 million. So effectively, spend £1 and you save 150 using this information sharing and use based on that partnership of individuals coming together to tackle violence. So very cost effective. So what does the data do? It allows us, the information from A&E, to identify new hotspots. So hotspots for violence we've just not known about. Now this is a famous watering hole in Cardiff, which many of you will recognise. But this is what the information does. Actually, the Philharmonic was not one of these hotspots in actual fact. This is just an example. But it's a troublesome, the data showed us, allowed us to identify troublesome watering holes in Cardiff. Now, this reminds us of a very, very famous public health experiment or observation back in Victorian London. This is John Snow and the Broad Street Pump. Who knows about him? Very famous this was. The Broad Street Pump was a cholera-infested water supply, and this person, John Snow, identified the deaths in the houses and worked out that they were caused by the fact that the households got their water from this troublesome watering hole here. So it's the same thing. It's a new application of that old lesson. So how does this information from casualty work? Well, it works because if the police know about the hotspots and they know about them more comprehensively, then it allows police to intervene earlier and more frequently and actually be there when the violence is kicking off. And of course, that deterrent effect and then charging people for common assault early on in an argument or the early stages of a punch-up, that keeps people out of hospital and keeps people out of prison, of course, because we're effectively preventing, it's not just the injury, but it's the offences happening in the first place. So there's a big cost saving and a real benefit, we think, to society from this kind of system. And this enterprise has been incorporated in a new guideline in the Casualty Doctors Royal College, which is the patron there is Princess Anne. So this is a way of getting the casualty doctor community in the UK and in fact in the Commonwealth, as this college has influence there, to take on this new role. And it is new because casualties their key role, isn't it, to receive and treat the injured, but using casualties and treating them as hubs for prevention is a very new approach. And there's a bit of a culture shift to try to manage there, but this obviously helps, this new guideline. Now, just one component of this violence prevention enterprise. It's about policing, it's about identifying new hotspots, and I said I'd come back to the glass issue. This is another patient. He was injured, he's glassed on a dance floor by somebody that just come off a ship, actually, in the Royal Navy as it happened. But it's a nasty, nasty injury, isn't it? It's just deforming, and he's got that for life, that scarring. So what do? We thought that we'd look at the pint glasses, which we knew were the main weapons used, and then do an experiment where we change the glasses in 57 bars in South Wales and the West Midlands, either on a random basis, either to toughened glass or non-toughened glass, and found that the toughened glass actually had really important injury prevention characteristics. It was more difficult to break, and when it did break, it tended to break up into these relatively harmless sugar lump bits, rather reminiscent of a car windscreen, isn't it? The old-fashioned kind. And we've actually moved to laminated beer glasses now. There's some really interesting, exciting new designs out there. And this was adopted by the pub trade in the late 1990s, and the licensee, which is the trade newspaper, trumpeted trade switches to toughened glass. And that was on the back of a campaign of ours called the Face of Wales campaign, which was designed specifically to shift towards toughened glass in the pub trade. Now, Damilola Taylor in South London, the black teenager, 14-year-old, was killed with a supermarket lager bottle. But it's entirely preventable. We've got these high-quality, squashy bottles now, and it's an obvious extension of this kind of research. There's lots more opportunities to prevent violence in these kinds of ways. So it became a coalition government policy. They want now the casualties must share information to prevent violence, and there's take-up in these countries. And the Centres for Disease Control, who helped us with the evaluation, they're taking it forward in the United States. And this is particularly exciting, we think. There's a trial going on in the Western Cape, in Paarl, in South Africa, and where there is a hugely greater rate of violence than there is in this country. So we wait to see how it works there with great interest. Now, there's a spin-off, and I hope this comes as a bit of a surprise to you, because one thing leads to another, and going back to this partnership, we thought, well, there's some interesting contrasts here, because whereas the medics here are trained in university schools, there's no opportunity for the police to do that. No police schools, no R&D, and the kind of thing that I've been talking about. So we started to think about the research background of policing and medicine and compare the two. And now you'll be very familiar with headlines in almost every week about medical breakthroughs. And these are the high-quality medical evaluations in the 20th century. And this is everything else. So this is a stunted plant. Education, probation, policing, prison service, hugely fewer rigorous evaluations. And we think that, and I'll move on from this, that this is because in a medical school we integrate research, education, training with the National Health Service. The whole thing's joined up, and you get this brilliant community where it's a real powerhouse of R&D, but also where the services are delivered, in the university hospital up the road, for example, where I work. Now, a cartoon is worth 1,000 words, isn't it? So I want you to imagine that this is the GP's Christmas Bash 1935. Got that? GP's Christmas Bash 1935. And here are the GPs. They're all lined up here for their Christmas drinks and canapes and everything else. And they've invited a local scientist along from the local university. And look, he's like a fish out of water, isn't he? There's no join-up between the two. You know, this integration is just not happening. What happened when this situation was realized, the modern medical school took off by the appointment of clinical academics. This is a practitioner researcher. This is actually Robert Winston, famous practitioner academic, but he's partly an academic, so he can talk to the scientist and get the products from him, the new ideas, innovation, but also he's got his arm around the president of the GP's Royal College, if you like. So you get that join-up, and the research agenda is then as it should be. So my last slide is a photograph of the Prince of Wales opening the first UK police school here in Cardiff as a result of this observation. Thank you very much.